ಸಾಮಾನ್ಯವಾಗಿ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಮಿಕ್ತವರೆಲ್ಲ ಒಂದು ಸ್ವಲ್ಪ ಪ್ರೈವೇಟ್ಗೆ ಹೋಗ್ತಾರೆ, ಹೆಚ್ಚಾಗಿ ಪ್ರೈವೇಟ್ಗೆ ಹೋಗ್ತಾರೆ. ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಸರಿಯಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗೋಲ್ಲ, ಡಾಕ್ಟರ್ಸ್ ಟೈಮಿಗೆ ಸರಿಯಾಗಿ ಸಿಗೋಲ್ಲ. ಈ ಜ್ವರ ಜಾಸ್ತಿ ಕಾಯಿಲೆ ಅಂದಾಗ ಚಕ್ಕನೆ ಸುಸ್ತಾಗಿರ್ತೈತೆ, ಅಲ್ಲಿ ಹೋಗಿ ಕಾಯ್ಕೊಂಡು ಟೋಕನ್ 2 ರೂಪಾಯಿ ಕೊಟ್ಟು ಕಾಯ್ಕೊಂಡು ಕುಂತ್ಕೊಬೇಕು, ಕಾಯಬೇಕು. ಹಂಗಾಗಿ ಒಂದು 50 ರೂಪಾಯಿ 100 ರೂಪಾಯಿ ಹೋದ್ರೂ ಹೋಗಲಿ ಪರವಾಗಿಲ್ಲ, ಜಲ್ದಿ ನೋಡ್ತಾರೆ, ಟ್ರೀಟ್ಮೆಂಟ್ ನಾವು ದುಡ್ಡು ಕೊಡ್ತೀವಿ, ಜಲ್ದಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡ್ತಾರೆ ನಮಗೆ ಅನ್ನೋ ಮನೋಭಾವದಿಂದ ಪ್ರೈವೇಟಾಗೆ ತೋರಿಸ್ಕೊತಾರೆ, ಹೆಚ್ಚಾಗಿ ಗೌರ್ಮೆಂಟ್ಗೆ ಹೋಗಲ್ಲ. ಅಲ್ಲಿ ನೋಡಿದರೆ ಸರಿಯಾಗಿ ಅಲ್ಲಿಗೆ ಹೋಗಮ್ಮ, ಇಲ್ಲಿಗೆ ಬರಮ್ಮ, ಅಲ್ಲಿ ಬರ್ಸ್ಕೊಂಬ, ಕೂಪನ್ ತಂದಿದ್ಯಾ ಅಂತ ಕಾರಣಗಳು ಅವು 108 ಕೇಳ್ತಿರ್ತಾರೆ. ಪೇಷಂಟ್ ಇಲ್ಲಿ ಸುಸ್ತಾಗಿ ಓಡಾಡ್ಬೇಕಾದ್ರೆ ಅವ್ರ ಜೊತೆ ಒಬ್ರು ಆಳು ಬೇರೆ ಹೋಗ್ಬೇಕು, ಅವ್ರ ದುಡಿಮೆ ನೋಡಬೇಕು, ಒಬ್ಬರೇ ಹೋಗಿ ತೋರಿಸ್ಕೊಳಕ್ಕಾಗಲ್ಲ.
In most parts of India, if you need to open a small shop, even if it is just to sell tea or coffee, you need to get licenses. But if you want to start a clinic, you can just start a clinic and there's nobody to check whether you're a doctor, you're not a doctor, whether you're a nurse or you've not been qualified, you're just an ordinary person who decides he wants to treat.
Public health sector, it's a free of cost and the services are subsidized. Whereas in the private sector, we have a huge variety of providers ranging from unqualified, untrained doctor to a highly qualified doctors. And even when you look at the health facilities also, you have a small solo clinic to a highly specialized corporate hospital.
There are various studies which have shown systematically that the technical quality of care is not any better in the private sector compared to the government sector. In fact, many times it is worse because many times the private sector does unnecessary treatment because of the financial incentives. In fact, statistics show that about 60 million Indians every year become impoverished because of medical expenses only.
The Institute of Public Health is a non-profit organization that wants to strengthen the health system to ensure quality health care, especially for the poor. A lot of health factors are still unknown in India, so IPH focuses on research into urban and rural public health issues.
The poor suffer more from illnesses because of the surroundings, the environment, in the sense that there is not clean water, there's a lot of garbage, sanitation is poor, which is why we started IPH to strengthen the government health services so that at least the health services for the poor will be assured.
Making private and public health providers work together is challenging because of their different approaches.
70% of the Indian population, they prefer to go to private sector. Now, whatever the government talks about the statistics, you know, there is so much of infant mortality or there is so much of TB cases, malaria cases. It's just talking about the patients who are reaching public sector. What about those who are treated by private sector? Government has no clue.
IPH tries to find solutions to bridge all these gaps. Through an extensive e-learning program, it also trains healthcare professionals at the district and national levels.
The IPH e-learning course on public health management is one of the first of its kind in India. So I think we are the pioneers in e-learning, and that is thanks to ITM for giving us all that support.
IPH gains new insights through research rooted in local experiences. Healthcare issues are tackled in an active way from inside communities, like here in the Urban Health Programme in KG Halle.
The Urban Health Program is an action research program, which means that we work with private doctors and government doctors, with the community and with the elected representative from this ward of the city. So we are trying to improve the quality of services using all the local stakeholders. So they come into dialogue with each other and we try to come forward with a common solution. The community viewed us 4 years ago, one more set of people coming and asking us questions. But today, our girls and our team are invited into the homes and people say, please come, we have this problem, can you help us sort it out?
ITM has helped us grow as an institution, but more than that is the relationship that we have with ITM, which is built on a solid foundation of trust and transparency. We treat each other as equals and we learn from each other. Truly a two-way interaction.
Making healthcare in India work is a vast undertaking, but local talent is rising to the challenge.
It feels like you're navigating between rocks in a river and you have to get to the other side, which is quality care.